This is KGW News at 5.
We start with developing news involving masks and your children. The Oregon Health Authority says it will extend masking rules permanently in K through 12 schools. The temporary rules expired today, and legally they can't be extended on a temporary basis. The OHA says it's working to determine when it will be safe to lift the school mask mandate. State health officials are also reviewing public comments on the mask requirement in all indoor public places. That temporary rule expires February 8th. So stay tuned for more on that. Good evening on this Friday. Thank you for joining us. I'm Laurel Porter. 1,200 city workers in Portland are planning to go on strike after months of bargaining for a new contract. Our Bryant Clerkley is at City Hall with a look at what a strike could do to city services. Bryant?
Hey, Laurel. Well, union members tell me that the Portland Bureau of Transportation, the Water Bureau, and other entities could be impacted by this strike. The union had to give the city 10 days of notice before they went on strike, and they did that last night.
Portland city workers came together last night in preparation for a strike. The union says the vote to strike passed with 86% voting in favor.
Electricians cost what electricians cost. Plumbers cost what they cost. The work we do has a real value, not just to the city as an entity, but throughout the city in numerous other areas.
Rob Martineau works for the Water Bureau. He and other members of the District Council of Trade Unions won a 2% raise. The city offered employees a one-time $1,500 bonus. In certain wage brackets, employees would get a 5% cost of living increase.
We want to make sure that there's an opportunity to work with the city, but it's important that the city recognize that it's time to get to an agreement. A contract should not take nearly 2 years to negotiate.
Negotiations with the city have been going on more than a year. The current contract expired in June of 2020 and was extended 6 months. If there's a strike in February, parking enforcement, tech services, and transportation inspections could be impacted, along with the Water Bureau.
We are the folks that keep the pump stations running, the electricians at Swan Island. We are the accountants that do the accounts receivable and pay the bills for the city. The building permits process, new permits won't be issued if we aren't there to do that work.
So the strike is set to start on February 10th, and in an email from the city, they have publicly stated that they do not anticipate any major service disruptions. Back to you, Laurel.
Thank you, Bryant. Portland's rise in deadly gun violence continues. The latest incident happened early this morning in the Old Town neighborhood. Officers were called to Northwest 2nd and Cooch about 2:15 this morning. When they got there, the victim was found alive, and police began administering first aid. Paramedics eventually took over and transported the patient to the hospital, and they later died. Police are now asking for your help to catch the killer. Anyone with information is asked to contact Portland Police. Portland police are providing new information about what led up to a Clackamas County deputy shooting a man. A preliminary investigation shows deputies were called to a domestic violence situation. They reportedly knew the suspect, Wesley Chance, had a history of possessing guns and body armor. When they tried to pull him over, he took off in his car. At least one deputy says they saw Chance pull a gun during the pursuit. Chance eventually crashed and flipped his car near I-205 and Market Street in Portland. Chance reportedly ran off with a gun and began confronting drivers on the interstate. And that's when a single deputy shot and killed him. The investigation is still ongoing. There is a bit of good news on the pandemic front tonight. Case numbers dropped dramatically in the week that started January 16th. Multnomah County Health tells us the numbers were down by 23%. That's the first drop since December. Statewide, new cases are also flat for the last 7 days. Now, these could be signs that the worst is behind us, but it is also possible that more people are doing home tests and not reporting the results. State epidemiologist Dean Seidlinger said either way, we should still worry about rising hospital numbers, which are nearing an all-time high.
But as I said last week, even if cases have leveled, it will take several weeks for hospitalizations to peak and then return down to levels that are not stressing our hospital system.
Dr. Seidlinger also said the pandemic has been hard on many people's mental health. But he added there has not been an increase in the number of suicides from 2019 through now. We turn now to Southwest Washington, where new data is out on how many people are dying from COVID. Clark County reported 28 COVID deaths in its weekly report, the most we've seen. But that number needs to be put into context. For that, we go to our Tim Gordon, who is live in Vancouver. And Tim, those numbers didn't occur just in the past week.
Yeah, that's really the bottom line here, Laurel. In fact, most of the 28 deaths that the Public Health Department just announced happened earlier this month, and some happened earlier than that. Unlike the reporting of new cases and hospitalizations, reporting COVID-caused deaths is a slower process. Clark County Public Health's Dr. Alan Melnick explains why.
Physicians caring for the patients have to review the case, complete the death certificate, and that gets reported to the state health department. So that can take a while.
With that context in mind, here is a breakdown of the deaths. Again, 28 from COVID were just announced in Clark County, but reporting delays of 10 to 12 days are common, sometimes longer. So in this case, 90% of the deaths happened between January 8th and the 19th. 2 were from December, and 1 was from back in August. Still, altogether, it pushes the Clark County death toll to 667. Also, of the 28 deaths, 13 people were in their 80s or older, 5 were in their 70s, 4 in their 60s, 4 in their 50s, 1 person, a man, in his 40s, and 1 woman in her 30s. It's difficult
really
but important information.
Picture, mortality information gives us one picture of the health of our country and of our state and our community. It's important to know accurately what people are dying from.
Dr. Melnick is watching other data too. Hospitalizations from COVID are at 118 in the county right now, and capacity is at 96 to 97%, currently with a slight downtick.
Hospitalizations seem to be going down, but given where we're at, I'm concerned over the next few weeks about our hospital capacity and what's happening there.
Where we're at is astronomically high COVID activity, measured in new cases per 100,000 residents over a 14-day period. This week, Clark County is at 2,549. Last week, it was 2,206. The week before that, 1,679. While back on December 23rd, at least we were in triple digits at 263 new cases per 100,000.
2,549 is, that's ridiculously high, right? I mean, at the peak of the Delta wave, I think we're around 550 or so.
That high Omicron activity is what is keeping Dr. Melnick up at night right now, because it is not showing the mega surge trending down yet. Yeah, and we know from experience that hospitalizations and deaths lag behind those new COVID cases. So it is a really good time to be vaccinated and vigilant, Laurel.
Tim Gordon live in Vancouver. Thank you, Tim. Anyone living in Washington now has access to free N95 masks. They were sent here as part of the federal effort to give away 400 million of them through pharmacies and health centers. The Washington State Health Department doesn't have a list of specific locations just yet, but the federal government says they're going to companies that participated in its vaccine program. So think Safeway or Fred Meyer. Masks are limited to 3 per person while supplies last. A state-run program in Washington that gives paid time off to care for a loved one could be out of money by March. The paid family and medical leave is a fairly new benefit for workers in the state. It offers a maximum of $1,300 a week for up to 12 weeks. 3 times as many people signed up for it as originally projected, so the program could be running in the red in just 2 months. Governor Jay Inslee says the pandemic played a big role in the issue, but he's confident legislators will find a fix.
COVID happened. We just started a new program. And of course, in any new program, trying to do the actuarial analysis is difficult. And then boom, you get hit by this COVID pandemic where people rush to leave to use this incredibly important benefit, and they have.
Lawmakers are looking at several options. Washington State Senator from Vancouver, Linda Wilson, says federal and state pandemic funds should solve the problem this spring. And she's proposing using revenue from the state's marijuana tax to fund the program long term. While the world waits to see if and when Russia will invade Ukraine, there are tens of thousands of people in Western Washington who are hanging on to every development. The troop buildup on the border of Eastern Europe has been developing over several months. Just today, the White House said enough soldiers are now in the region for a full-scale invasion. For those who escaped post-Cold War Russia and came to Western Washington, they fear Russian President Vladimir Putin is about to put their country and extended family in danger.
We're looking at over 100,000 Russian troops on Ukraine's border. We're looking at troops pulled from all the way from the Far East across 12 time zones to Ukraine. If this is an exercise, it's a pretty serious exercise and the largest that we've ever seen. Yeah, it's a serious threat.
Seattle does have an honorary Ukraine consulate, and it's also concerned about how this situation may play out. They're also raising concerns of how it will impact global economics and put a strain on an already struggling supply chain.